The question of whether to test for HER2 in patients with lung cancer is one that comes up often in the clinic. It's not necessarily a standard part of the testing that we do for patients who are diagnosed with lung cancer. More standard tests are EGFR and ALK. I think it's becoming more and more important to test for HER2 because we are seeing some evidence of efficacy in the treatments that target HER2 in lung cancer. And only testing the cancer for HER2 is the only way to know if those treatments may be effective. So the testing requires taking a piece of the biopsy tissue that was already obtained, or sometimes requires a new biopsy, and testing for that mutation. And again, I think the reason it's important is that we are starting to see evidence of benefit. There are several trials that are looking at HER2 therapies and patients whose tumors are found to have a HER2 mutation. I would encourage to at least think about those clinical trials. There are also HER2 targeted therapies that are already available on the market, both in lung cancer, and that's specifically afatinib that targets EGFR as well as HER2. It's not FDA approved for the HER2 population, but it's something worth considering as there is some data. And there's also trastuzumab, which is approved for treatment of breast cancer, not lung cancer. But it's something, again, that's been tried in patients with lung cancer whose tumors have the HER2 mutation, and there does seem to be some evidence of benefit, albeit in small numbers, patient numbers, and not in prospective randomized trials. But it's something I think we know is safe in patients with lung cancer. Whether it's effective in those patients and may help them, we're starting to see evidence that it may be helpful. So the only way to know if those treatments are helpful is to test the cancer. And I think that more and more doctors are starting to test the patient's cancers for HER2 because there are those options or potential options for treatments both on and potentially off trials.